How to use the rapid response oral fluid lollipop drug test. Before testing, bring the test to room temperature. Do not place anything in your mouth including food, drink, gum, or tobacco for at least 10 minutes before the test. The lollipop test includes a results window, a drugs table, and an oral fluid collector. Some tests will also include an alcohol strip. How to use the test. Step 1. Remove the test from the sealed pouch and use it within 1 hour. Step 2. Remove the cap to uncover the oral fluid collector. If the test includes an alcohol test strip and the color pad has a blue color before testing, do not use the test. Step 3. Place the collector in your mouth. Do not let saliva touch the plastic body of the test. Keep the device level and do not tilt it. Hold it in your mouth until saliva flows across the test strips and the control lines C appear on all strips. Step 4. Remove the test from your mouth and put the cap on. Place it on a flat surface and start the timer. Reading alcohol strip results. If the test includes an alcohol test strip, read it 1 to 2 minutes after removing the test from your mouth. When positive, the alcohol strip will be either blue or green. This means alcohol was detected. The level can be determined by comparing the color to the chart. When negative, the alcohol strip shows no color change. It means alcohol was not detected. After collection of saliva, if the alcohol test pad is dry or has blotches of color, do not interpret the results. Dispose of the test and use a new test. Read the drug test results at 10 minutes. Do not read the results after 20 minutes as they are no longer valid. To read the drug table, follow these steps. Step 1. Find the drug name in the table. First, note the strip number. Then, note the test region. Step 2. In the results window, each strip is a column labeled S number, and the test lines appear in rows labeled T number. After noting the strip number and test region, match them in the results window to find the drug's position. Step 3. Check the control line on the same strip in the results window. The control line region is located in the top row labeled C. Reading drug test results. The test shows a preliminary positive results if the control line C appears on that strip, but no test line appears in the test region T for the drug. This means the drug was detected above the detectable cutoff level. The test shows a negative result when the control line C appears on that strip, and a test line appears in the test region T for the drug. This means the drug is not present or is below the detectable cutoff level. Even a very faint line is considered negative. A result is invalid when no control line appears in the control region C for a strip. Do not interpret invalid test strips. Repeat with a new test if needed. For example, when reading drug test results, the drugs highlighted here are preliminarily positive because the control line appears, and no test line appears in the test region for these drugs. In this example, benzodiazepines, amphetamine, and MDMA are positive. All other drugs are negative. The drugs highlighted here are negative because both the control line and test line appear for these drugs. In this example, cocaine, methamphetamine, marijuana, opiates, barbiturates, phencyclidine, and methadone are negative. All other drugs are positive. These results are invalid because no control line appears on strip 3 and strip 5. In this instance, repeat the procedure with a new test. The Rapid Response Oral Fluid Lollipop Drug Test is compatible with the RapidReader app. Streamline your workflow with faster results processing and direct EMR and ATS system integrations.